Good morning, everyone, and welcome to the NJDVHIMSS Virtual Fall Conference. Whoo! Yes, ready to get this started. I'm Chaz Thawley. I'm the president of NJDVHIMSS chapter. Normally we'd be gathered right here where I am at the Hard Rock in Atlantic City. We would have a chance to meet face-to-face, network, learn, enjoy a few meals together, along with some cool time dancing on the dance floor in the club. But I'm sure you don't want to see that again this year. But here we are in the time of the pandemic, and we have shifted to a virtual event for everyone's safety. I hope every one of you and your families are staying safe. So we're gathered here for the next 2 days with over 400 attendees, 400. Great turnout for a virtual conference, especially our first virtual conference. The opportunity to hear our keynote presentations and panel discussions from our game changers in health IT. As president of NJDVHIMSS, I'd like to thank you for your attendance and encourage you to get involved with one of our many committees. Committees are a great way to make the most of your membership. The NJDVHIMSS committees include advocacy, healthcare informatics, digital media, events, sponsorship, membership, scholarship, and security, privacy, compliance. Security, privacy, compliance have a great list of archived presentations out on the website. So stop by our website. You can also get involved there. Send us an email, let us know you want to help out, and we'll be glad to get back to you. So this virtual conference and all of our conferences would not be possible without the support of our sponsors. So on behalf of the New Jersey and Delaware Valley HIMSS, I'd like to thank all the sponsors for their continued support. So please take time over the next few days to visit them in our virtual exhibit hall. There will be a link in the chat to the hall. So before I turn the camera over to our first keynote presentation, please know that the sessions will be recorded and you'll be able to ask questions by using the QA button at the bottom of your screen. These questions will be addressed by the moderator at the end of each presentation. For each of the 6 sessions over the next 2 days, participants that stay for the duration of the presentation will have a chance to win $200 gift card. That's 200 bucks. I don't think I'll get to win, but I know somebody will, 6 people will. So you have to be present at the end of the presentation to win that money. So without further ado, I would like to turn it over to Chris Capello with Nutanix to introduce this morning's keynote speaker, Sean Slavinsky. Chris?
Thank you, Chaz, and the rest of the Delaware Valley NJDVHIMSS organization. Nutanix is so grateful and honored to be an executive sponsor of this event, especially in these challenging times. So who is Nutanix? Nutanix is the undisputed leader in hyperconverged infrastructure. Healthcare organizations around the world use Nutanix cloud software and hyperconverged infrastructure solutions to bring one-click application management and mobility across public, private, and hybrid clouds, thereby improving clinical and IT workflows throughout the continuum of care. The simplicity and freedom to build the preferred cloud deployment allows customers to run any application, such as EMR, PACS, and big data, that will help improve the quality of patient care and lower the total cost of ownership. And with that, I couldn't be more pleased to introduce today's opening keynote speaker, Sean Slavinsky, CEO of BioIQ. Sean Slavinsky is recognized as a healthcare industry innovator with a 30-year history of success. Sean is a proven senior executive and entrepreneur with an established track record in defining and building businesses from concept to viability within the healthcare field, demonstrating strong leadership presence and the ability to motivate employees and stakeholders around the shared vision, both within large, mature companies and in the early stage of business. Sean, it's great to have you and welcome.
Well, thank you so much. I appreciate it, Chris, and good morning to everybody. First off, I wanted to say I hope all of you are staying healthy. For those of you or your friends or family that have been affected by COVID in some way, shape, or form, I'm wishing a speedy recovery to all of you. I know some folks that I'm familiar with that are on this call. Some of you are actually out on the West Coast, so bless you for getting up this early, and I hope your coffee is strong. But it's a pleasure to be here. So I had a few folks already ask me some questions before, even getting on this morning. One of those was, Sean, do you even have a background in health IT? And why you? And why this topic? So I thought I might talk a little bit about that to give some context to the thoughts, ideas, and positions I'm going to share with you over the next, 40 to 45 minutes, and then a chance to answer some questions. My background has been this intersection between human behavior change and technology. While I'm not a technologist, I actually started out as a school teacher and found myself in a position of building fitness centers, medical centers across the country for large companies right out of college, like Ford and General Motors and others, to help keep their employees healthy. I kind of caught this bug between how do you actually get people to be interested in their health and do something about it, most importantly, and how do you understand what they think their needs are, and get them to take charge of that. And it's been a 30-year journey from that first company in Toledo, Ohio, doing all this great work with all these big name brand organizations and improving the health of their employees, through working with some of the top health systems and some of the largest companies in the country. Most recently, before joining BioIQ, I was the president of Walmart Health and Wellness for the past 2.5 years. And that was quite an exciting journey, trying to understand, how does the customer think? What do they need? How do you actually disrupt healthcare in a way that people, on average, can access it and be more affordable? And then how does IT and how does systems and digital play into all of that? To my most recent experience of BioIQ, which is a technology company that actually aggregates and integrates with major laboratories, large and small, to distribute home test kits and on-site screening and testing, as well as immunizations for probably 2/3 of all the health plans out there in the country and their membership base, plus many large employers. So I've had this as I age and get over the age of 50. And for those of you that are on the meeting this morning, you probably can relate to some of this. In my mind, I'm only about 30 years old, although my face and my body tell a different story sometimes. But what I've noticed over these 30 some years in healthcare, in some ways, nothing's really new or changes. On the other hand, the one thing that makes everything more accessible is IT. And so today I'm going to talk a little bit about where are things going, what are we learning about the customers out there versus just thinking of them as patients, and how is technology in part driven by an acceleration due to COVID? How does IT and the need for access anywhere, anytime, coupled with the back-end infrastructure, how does all that kind of come together to look at the customer? And you also hear a common theme as I go through this today as well, of many times in healthcare, what I find, and I have to remind myself of this too, whether you're on the clinical side, the IT side, or some other aspect of healthcare, usually the biggest barrier to understanding the customer isn't the customer. It's our own position. It's our own brainwashing we've had for 5, 10, 20 years working in the field. We kind of get stuck in a certain way of doing and looking at things and people because that's what we grew up in. And understanding customerism, which is not a misspelling, it's intentional. You really have to stop that and just understand what people really think and what they really need and want. And then look back at what you're doing and go, how does what I'm doing relate to getting their needs satisfied? And what I find many times is the answer is it doesn't. So how do you start making changes in that? So if we could go to the next slide. Many people have said, and there are all kinds of different statistics out there, but because of COVID, while all of us probably wish it never happened, and certainly I know that's true for me, I wish it would have never happened. It did though. And that has escalated and sped up the pace at which people are willing to adopt technology in their lives around their health and well-being. It's not like it didn't exist before. Certainly there was telemedicine and telehealth and remote patient monitoring devices, and plenty of web technology and information out there. You know, I can recall when the internet really first became a thing and people could start accessing health information online back in the late 90s to early 2000s, where there was some of the biggest experimentation going on. The theory back then was that, well, everyone will just serve themselves, they'll learn so much, and you know, people's weight will go down, diabetes will start to disappear, it'll be amazing because of all this information. But that just didn't happen, did it? Lots of information, lots of people reading more things, but we've gotten more unhealthy as a nation through the course of that. Now, there are a lot of reasons why, but it's not due to a lack of information. It's due to getting people what they need when they need it at that right moment. And people can't necessarily imagine how that would work virtually, when in healthcare in particular, they've only worked one way, and that was you either go in person or it doesn't really help you. COVID's kind of moved us forward technologically and the acceptance of that by at least 3 to 5 years, and I would contend maybe even more. What that's done is driven the expectation that we all move faster and keep up with them and keep up with the pace of other industries that have driven more virtual engagement with the customer. And I think what we're going to see, and this is in large part what I'm going to talk about, is the customer is going to drive a lot of what we need to do. We're either going to catch up to that or we're going to become somewhat obsolete. If we could go to the next slide. Thank you. Couple points on this page, and you know, I'm going to infuse some commentary into each of these. So, omnipresence. The word omni, if you were like me, it pretty much, you heard it in most cases in and around going to the Omniplex to watch a bunch of different movies when we could all go do that. You know, this omni-channel approach to customers, being omnipresent in all these different ways. All of a sudden with COVID, omni is everywhere. And simply put, it's, I want what I want when I want it the way I want it. It's really kind of that simple. The difference today is that while they may not always want it, they need the digital interaction and they need a seamless experience of information and support as a customer around their health, where they didn't really expect that before because they had other means of getting to it, but now they don't. And so the word omni is really important. And the notion of I want what I want when I want it the way I want it is a big theme going forward. It's always been omnipresent, but it hasn't necessarily been this meaningful when it comes to healthcare. It's certainly been very meaningful in other industries. Demanded and created. You know, when we think about what people really want, when you look at how you do your own shopping, how you interact with different services, from Amazon and buying things online to getting an appointment for your car, to scheduling a doctor or dentist appointment, to getting your pet groomed, we have demanded a certain level of ease and a certain level of access, that whether it's a phone call, an app on my telephone, stopping in to set up an appointment or do something, to get things shipped to me and then be able to track them like a pizza tracker to know when exactly it's going to get here and why. That didn't really exist in healthcare in a massive way or in a common way. But now people are expecting it because they're getting it in other areas of their lives. I remember going back many, many years, the fact that most of the practitioners, when the use of the telephone, this is going back again into the early 90s, actually, late 80s, the use of the telephone to do disease management and health coaching and those kinds of things, the customers actually wanted it. They didn't know they could get it, but once they started having it, they were like, wow, this is easy, it's convenient. In the good old days when information wasn't protected quite the same way, and I don't mean that's a good thing, it was just a lot easier. You could leave voicemails for people, they could listen to those, take some direction or advice from their health coach or their nurse. and then go do that, and then pick up the phone and leave a message for their nurse or their health educator or their nutritionist, and they could voicemail back and forth, kind of like email eventually became. Well, most practitioners, and I remember sitting in rooms with hundreds and hundreds of nurses and doctors and personal trainers, all sitting there saying, there's no way you can change behavior or affect a person if you don't lock eyeballs with them. If you can't see them in person and touch them, this phone thing will never work. Well, the customers started demanding it, and then it became more cost effective. And in some ways it worked amazingly, and in other ways it fell a little bit short of in person. And then as the internet came about and people started to access more information online, being able to buy things online, et cetera, folks started to demand that healthcare catch up to that. And then I remember sitting in meetings with doctors and nurses and whole call centers in some of the largest EAP, work life and disease management companies in the country. And it was a repeat conversation. Well, there is no way that you can change someone's behavior or get them engaged in their own healthcare if you can't hear their voice. So the nice thing is, over probably a 10 to 12 year time period, we went from, if you can't see them and touch them, you can't do anything, to the phone becoming much more accepted. So now people had shifted their mentalities, the practitioners and professionals, into, well, if you can't hear them, then you can't change behavior. And then here comes the internet, where in many cases, you can't necessarily hear them back then. You may not be able to see them back then because the technology wasn't that far along, but you could email, so you could still communicate. But there was no way to do that until there was, and until the customers started demanding it. And again, I think this is a common theme that we're starting to see again, but exponentially so. It's the practitioners, it's us as IT and healthcare professionals that many times we get so stuck in the way things work that we actually don't think it's possible for things to happen the way that they need to on what the customer really wants or needs. But actually, the customer is the least barrier to getting things done. It's really more us. And that's been my challenge and my mantra for probably the last 25 years in particular, is how do we look outside ourselves to see what the customer is actually looking for right now? And how do we see what we do just a little bit differently to kind of try to meet them where they currently are? And, you know, the last little piece here, consumer-centric system. And when I say system, I mean technologically, I mean physically. It comes back to that whole omni idea. There isn't necessarily one way that a customer wants to be served. There are multiple ways, and it's really up to us to figure out how we do that. But the expectation is really great right now, greater than I've ever seen it before. If we could go to the next slide. So I often hear from people in the industry today, boy, is it hard to get anybody to do anything, take care of themselves. Oh, there's so many gaps in the care. You know, people just aren't doing what they need to do. It's actually true in comparison to what's possible with all the tools and resources available to people. But when I look back to 1989, when I was working with some of those large corporations and their employees, and they didn't have cell phones, they had a regular phone. Many of them just got cable TV. And all they had was what was right in front of them, or to go somewhere to work out, or to see a doctor, or to get care. There really weren't a lot of options for them. And so people just didn't actually understand what was possible and what they could or couldn't do to change their lives and their health. Fast forward to today, I see those same types of folks in those same settings vastly differently than 20 years ago. There's tremendous change in the way people understand and look at things, at the resources available to them in all the different omni ways to get to them. I find that the lack of knowledge of people knowing what to do, or even where to go get it and do it, is fairly low. I mean, they actually know what they need to do and how to get there by and large. What they don't have is that motivation or that first step to, I'm actually going to go do that and stick with it. And that's actually where the technology comes into play, because it's a low threat barrier to get people actively engaged, even in the smallest way. And so compared to 20, 30 years ago, I would say there's been a significant increase in people's understanding and knowledge about what they should do. I can remember sitting with a lecture hall of 100 employees at these big organizations 20 some years ago, and sitting there with them, and class after class at the time of how to eat better, how to lose weight, how to stop smoking, how to do preventive self-care, and they literally didn't even know what cholesterol was. And the notion was, well, beef is good and chicken doesn't taste as good, so I'm just going to keep eating beef and I'll burn off more of the fat. And that was kind of the whole mentality back then. Now you get into these rooms with people who are fairly unhealthy, but they go, yep, no, I know I should be eating salads and chicken. I know I can make them taste better. I know I need to go see my doctor because I'm over 40 or I'm over 50 or I'm over 60. And I kind of know what I need to do. I just don't get around to it. I have other priorities. I don't think I can afford it. But when you start exposing them to technologies that can help them take those first steps, it becomes quite contagious. So understanding that people are actually pretty smart, believe it or not, regardless of socioeconomic level, about what they should be doing is pretty high. It's helping them have the ease of taking that first step. And that's where I think we as healthcare professionals, clinicians, IT professionals, system thinkers, if we step back and just kind of look at what's possible for people and what that simple first step can be, I think we're going to get a whole lot more engagement than we have seen before in the entire healthcare system. But there is this expectation, just like when you go on to an Amazon or a Walmart or a CVS or a Walgreens website and you're getting your prescriptions filled while you're reading information, while you're looking at your biometric test results, et cetera, there's an expectation that all that stuff's in one place. And while we've made strides towards that, it's very difficult for the consumer. But they're going to be demanding it more and more, which is just going to put more pressure on healthcare to be more like more consumer-oriented companies. Not a new idea, not a new concept. We've been hearing this forever, but the day has come because the demand for this is so strong and high. Those that don't get on board with it quickly enough actually are going to start losing a lot of market share and a lot of customers to go to where it's easier and things actually get accomplished. If we go to the next slide. On that topic, I was thinking the other day, we just completed some focus groups on what folks really think are great experiences. And boy, I wish that healthcare was like fill in the blank. And as we were doing some of this research with Deloitte and other top research and brains out there in the country, there were some common themes and common groups that came up that set up the example of where the consumer today is saying, this is good, not perfect, but good. And boy, I wish my healthcare was like this. So Netflix, if for those of you, again, and I hate to keep dating myself, but if you remember going to Blockbuster or Hollywood Video and, racing there to get the new release on Friday when it came out and trying to get on the wait list, how much easier does it get? There's a VHS tape waiting for you 5 minutes from your house, and you can stop and get popcorn and pick up dinner and take it home for family movie night. Does it get much easier than that? And more interesting and exciting because you're actually looking forward to that versus going to the doctor's office and getting a shot, right? Or having a needle stuck in your arm to get some blood drawn. So that's a pretty happy environment, right? Go get a movie, get some dinner, go home. Man, this is great. And then Netflix comes along and says, nope, I'll mail all this stuff to your house. You don't even need to go out. And I remember in the news and the press and even friends talking about, that's just stupid. I mean, who's going to go do that when you could just drive down the street? How lazy are you? And then all of a sudden, a year later, we're all doing it because it was just easy and we didn't have to leave the house and we could just have a pizza delivered, or we could cook food and just have it show up and mail it back. And then over time, one of the things that people most recently have said is, it's so nice to have on the demand video, which was the next big thing, but it's the personalized recommendations that we really wish we could get to that level and that degree in healthcare, which is not ubiquitous and not common right now. So the personalization aspect is really important to the consumer today. That ease, really important to the consumer today. And it all started way back when somebody said, hey, let's mail DVDs and VHS tapes to people's houses instead of them driving down the street or walking down the street. The people within the industry of VHS and sitting there doling those out at a physical location sat there and went, that's just stupid. It's ridiculous. Who would ever want that? It was their inability to change, their inability to see where the customer might want to go or might find value, that actually destroyed that whole industry kind of overnight. And that's my worry in healthcare, is if we don't catch up quickly enough, or those that don't catch up quickly enough to the concept of a Netflix, for example, versus Blockbuster, we're going to find ourselves there as well. The other one is Amazon. I'm not going to talk about all these, but I, again, remember when Amazon first launched as a bookseller and everyone was like, who in the heck would ever order a book online? That's just silly. And what a weird name. Has nothing to do with books. But that wasn't the vision back then, was it? It was kind of like a Netflix, order a book online, we'll send it to your house, versus you go into a store. But the real idea was, how do we get people that would like to just shop in their homes to shop in their homes and buy from us instead of going to the store? It was the same thing when QVC and Home Shopping Network first came out. There was this groundswell from the brick and mortar stores going, that's just silly. Who's going to watch that? And buy stuff off a TV and make a phone call to buy things they've never seen or touched. And then before you know it, Home Shopping Network and QVC are selling more than some of the department stores. And then Amazon expands itself into selling more than just books. And before you know it, more shopping happens on TV and online than in the stores in some cases. This is the evolution we're moving towards in healthcare, and we have been for a long time. It's just we have a more complicated payment mechanism that prevents some of that from happening as quickly. But with COVID hitting and the demands being higher, the idea of virtual and convenience just became more acceptable. And I think we're going to start seeing the same trends of Blockbuster to Netflix, Barnes and Nobles to Amazon, et cetera, happening in healthcare much, much quicker than before, because the customers are already there. They already want that. These companies have defined the expectation. We're the ones lagging behind in healthcare. I think we can get there, but it's going to take a pretty Herculean effort for us to do that. And the first step is just changing the way we think about the customer and how we think about how we think versus what we currently have or do today. We go to the next slide. So just a few things that came out of these surveys and some focus groups, et cetera, that I found interesting. And again, I'm not going to hit on all of these, but you think about since COVID hit, 53% of the people out there are more likely, if not already, using some type of telemonitoring device or remote interaction with a healthcare professional than had ever done it or thought of it before. When I look back over the history and evolution of the internet and how it started to impact healthcare, I remember some of the first groups that came out with video meetings back in the early 2000s and trying to make that work over a dial-up modem. And the experience was horrible, but they patented anyways because they knew it was coming and they knew it was going to get there eventually. And when broadband came along, it started to change everything. I remember people saying less than 5% or so would be willing to interact with a healthcare professional in any other way, even on the phone, as compared to going to see a healthcare or a wellness professional somewhere. And now here we are, over half of America sitting there saying, I've either done it or I'm willing to do it, or I'm planning on doing it. Huge leap in 15 or 20 years, huge leap. And because of COVID, it's going to get even stronger and bigger. 42% of the consumers out there say that they use tools to measure their fitness and track their health improvement. Now, I remember in the good old days of paper and pencil and Franklin planners, for those of you that can remember those, only about 20 or 30% of the people would even use those. And it was in a mode and a method they were used to and comfortable with. Now we've got nearly half of people out there saying that they do something electronically to monitor and manage their health. And that's just who's reporting that. That's not all the people that we didn't talk to and who might not feel comfortable saying it, oddly enough. But huge jump. With COVID, we're going to see that number going up even higher. And then 68% expect some form of real-time or immediacy in what they actually get when they activate something, meaning I need to talk to someone right now. I need some information. I need to get my testing supplies more quickly, et cetera, et cetera. Nearly 70% of the people out there say, I get it from everyone else. I can go on DoorDash, order a meal and have it to me in 20 or 30 minutes, and I can track where it is and how to get to me. Why can't I do that with my prescription? Why can't I do that with my test results when I've gone to my doctor? What's so hard about that? If you can track a pizza and track a meal, why can't you tell me what's going on in the supply chain of my blood work? And today you can, but it's not ubiquitous. So the theme of this whole slide is people are expecting more. And when you look at these different chunks and areas and remove the word health and healthcare from it, and just look at the basics of immediacy, technology enabled, all my stuff in one place, et cetera, you start going, well, shoot, that's what I do every day when I interact with every other industry out there. Well, except for healthcare on a national level. And so we actually already know, and you all know, what people's expectations are, because they're the same expectations you have from companies as well. You just don't expect it from healthcare all the time because they can't produce it this easily and this well. But the demand is so strong and the customer is getting so pushy about it because now they need it and it's dire, that I think we're going to see a whole level of new pressure on all of us to get to that point. If we could go to the next slide. I'd be remiss, after spending the last several years in the consumer space and all that I had learned there with retail, what's really going on out there, and is brick and mortar dead? And what I would say is this: it's back to the omni-channel approach to things. Brick and mortar isn't dead. Technology and virtual interactions around your health and healthcare aren't replacing it completely. Again, this whole idea of an omni-channel approach, and you've seen it with a lot of the groups out there. So from Walmart and CVS to Kroger, Best Buy and Walgreens and City Block, all these groups and many more, I just picked these handful because I happen to be most familiar with them. They've all gone from largely brick and mortar to going virtual for many things, to getting into people's homes with delivery and healthcare services in ways that they had talked about, they had piloted, they had kind of dabbled with, but never really put it all together. And it's not to say they've put it all together and it's perfect, but even the brick and mortar world, based on COVID, has had to literally change over a 7 to 9 month time period. They've all had to accelerate their digital and omni-channel approaches, literally just to survive. And when you look at the statistics that are out there about virtual only groups like Amazon and others that became so much more embedded in people's lives and lifestyles because they were already doing business the way that COVID demanded in the lockdown society that we have right now. And you look at traffic to stores after the initial stock up and frenzy that happened when the threat of COVID was coming around. You know, in many cases, volumes of in stores have dropped by half or more, and everything switched to online. And most of these retailers, while they had actions and availability of virtual support and virtual services, et cetera, they really weren't built for the level of demand that was coming. And it's fascinating to watch what's happening with each of these groups and others, because I think it's analogous to healthcare. When you look at the brick and mortar versions of doctors' offices, surgery centers, hospitals, urgent care clinics, et cetera, and you look at the foot traffic they had or didn't have before, you look at the switch from physical to virtual for those things it's appropriate for, and you go back to Blockbuster versus Netflix, you can kind of see the evolution of where things are going for healthcare. Those that can adapt quickly and move forward will survive. Those that can't get omni-channel right, can't refine their business models to know when physical matters and when it doesn't, and to have at least an equal play for both virtual and non-virtual for a customer, those groups are going to start to fall by the wayside and may even disappear completely. That might have taken a decade before COVID, or 2 decades, because things in healthcare don't really move very quickly, as we all know. But now it's happening in months and a year or two versus a decade or two. And I think that's one of the things with understanding where the consumer is and where their demands are right now. It's really important for us as healthcare professionals and IT professionals in that space to realize our world's changing literally overnight on us. We don't have time to move slowly. We've got to catch up to the customer now, or we're going to find ourselves being a bit of a dinosaur. And I think if you look at brick and mortar stores and you look at some history lessons of the past, you're going to start to see where we might be in a year or two if we don't adapt and change quickly. If we go to the next slide. And why don't we go ahead and skip to the next slide, because I'm looking at the time. So this is the last slide before we get to any questions that people may have. And this pretty much just summarizes some of what I've said, but when you look at what the customer of the future, or I should say the customer today, is really expecting from technology companies or from the technology capabilities of any company out there, it boils down to these really kind of 6 themes. One is data comes together. In other words, the customer says, it's my data. I want it. I want to know it. I want to know it now. I want to have access to it when I feel like I need it in the way that I feel like I need it. And don't tell me it's hard. And by the way, this isn't me saying this. This is thousands of customers being interviewed and talked to, and just tell it to us plain. What do you really want and expect? This is the aggregate of their words. And one of the things that came out the most strong is, don't tell me it's hard. I don't really care if you have a problem getting me this. I get it from others in other industries. Just shut up and give me what I want, or I'll go somewhere else. I'm sure we've all been in that situation before where we didn't get what we wanted from a particular company. So we said, never mind. I guess I'll go to the other company and your other competitors and have a nice day. I will walk and use my pocketbook to make my decisions. They're getting there with healthcare now because they're starting to have those kinds of choices. Let's get personal. You know, this is the other aspect of this, which is I expect things to be tailored. I expect things to be about me and my plan, not some generic recommendation like, oh, you have diabetes, so cut down your carbs and walk more. and check your sugar level at least twice a day. So they want something tailored to me. How do I do that in my life? And why do I do that in my life? And why is this important for me to do in my life? So therefore, I'll go do it. My data comes together. It's mine. I want to see it. I don't want to hear you whine about how hard it is. Number two, let's get really personal about me, because it's about me. Show me the money. This is really, really becoming prevalent. And again, it's to the point that I just made. If you mess up, if I use Uber to try and get a ride and it's not happening 2 or 3 times in a row, people get late, they don't show, etc., which happens, I'm going to go use Lyft. And then when they start messing up on me, I'll go back to Uber maybe. Well, that's starting to happen in healthcare, where it used to be, I'll go to my doctor for 30 years and I'll never go anywhere else, and this is it, good or bad. Not the case anymore. I now have choices online. I can have 100 doctors if I want to. And so that choice becomes really important. Smart wellness. This is another thing that we really, really heard, is that now that COVID's come, people are keenly aware, regardless of your age, the healthier you are, the more likely you are to get through it. And so it's really shown a light on the healthiness and the well-being that you have is critical to your health. It's just like when flu season starts to come around in November, what starts to happen? Fitness center workouts spike. People start getting active. And then in January, New Year's resolution time. And then in February, when most people start to wane, well, usually you have a second round of flu kicking in. So people start working out more that have a propensity for it, because they know the healthier they are, the better shape they're in, the more likely they are not to get sick in the first place or to get through it easier. So smart wellness is really important, and people are really, really, really starting to understand that. COVID has pushed that along dramatically. Last mile, down to the last inch. A lot of us have heard in supply chain, whether it's in healthcare or whether it's in the consumer space and a shopping experience, the last mile is the most important. Well, we're getting down to a refinement thanks to COVID that, we really, really, really can get down to the last inch. In other words, I want my delivery of my groceries, for example, but I want it to be customized for me. I want you to have recommendations on what else I might be able to buy that would be healthy and good for my family. And hey, I don't want you just dumping it at my doorstep. I'd like you to come into my house. I'd like you to put it in my refrigerator. And I'd like some recipe suggestions with the food that I bought as well. And you can see the grocery chains, the big online providers like Amazon and others starting to get to that last mile, to actually the last inch of that personalization and convenience. Quite frankly, we're nowhere near that in healthcare. We're just trying to get that last mile right. But we've got to start thinking about that last inch as well. And, delightful experience. If I had a nickel for every time I've heard practitioners in healthcare, and I've done it myself, so I'm guilty, going, delightful? You want to delight your customers? How do you do that when you're poking a needle in them, or you're telling them they've got a disease, or, they're coming in pain? And well, quite frankly, just not having, and this is pretty common, stop having me fill out 25 forms when I come in to see you, or even online, especially forms that I just filled out the day before when you told me to pre-register for my visit. And then I come in and you make me fill them out again in person when I just did all that online, or I did it on the phone with some, call center person. Why does that have to happen? My data should all be there. Why do I have to answer it twice? Can we get more personal? How about some questions about me instead of this generic stuff? And this has nothing to do with that last mile, let alone the last inch of making things convenient for me and knowing what I really need. And so delighting in experience doesn't mean uptime and downtime of your system per se, which is what a lot of us measured on. Hey, we had 98.8% uptime. So customers could get to their stuff so they could fill out 12 different forms, 8 different ways. It's about them going, wow, I really felt cared for in this whole process. I really felt like it got really easy. And even though I didn't like having to go and be sick or have a needle poked in me, this was a delightful experience because I actually got help, and it just felt easy. And I felt cared for. And that's the last piece I'm going to leave you with here, is healthcare is actually pretty easy. While there's a great expectation from customers around technology and ease and convenience, really when most people start to engage in healthcare, they'll give all that up to some degree just to feel like the person on the other side of the phone, the video screen in person cares about them and takes that time and moment to show that care. It could be at the pharmacist's desk. It could be when you're registering at the front desk, whether that's online or whether it's in person. One of the things that came out of all of this surveying and market research, and in my own personal experience, is a smile and saying, "How are you today?" And waiting for a moment to get an answer versus using that as a quick way of just getting started. "Hey, how are you today? Okay, let's get into this." Versus, "Hey, how are you today?" Pause. In healthcare, we have this magic thing that grocery stores and Amazon and all these other retailers that have set the expectation for digital omni convenience is caring. They expect those others to deliver service and deliver on their promise. They like them to care, but they don't really care if they care because they don't expect them to care. They expect them to do the job the way they promised. In healthcare, they expect people like us to care. And then everything else ought to be easy too. So how do we get from where we are today to where the customer expects us to be from this omni-channel convenience? The first step is to recognize that we need to understand where the customer is and that we've actually just jumped 5 to 7 years or more ahead on having to get there. So we're out of time. Number two is we have the best defense for all the things we don't do well in healthcare, and that's actually to take the time to care. A smile, a genuine sense of caring. People will forgive so much other inconvenience if they feel like you care about them and their family. And so, as I've said to in every company I've been in, and somehow over my career, I started as a gym teacher and ended up getting to run some of the biggest organizations out there in healthcare. Nothing's ever perfect. There's always 35 systems that need to be integrated, and none of them talk to each other. There's always a deadline that was supposed to be yesterday and it never got done and you're scrambling to do it. But you know what, in healthcare, the one thing that I always say to every employee that I've ever had is, if you just take a moment to care, everything else will work itself out and we'll deal with it. And that's our secret sauce in healthcare, regardless of what position you play in the healthcare field, from the doctor down to behind the scenes making all that run. If we take a moment to care while we're trying to get our act together on this omni-channel digital stuff, that actually goes just as far and buys us the time to get our act together where no other industry has that. So my request, my urging for all of you out there listening to this today is, while you got to understand the customer, whatever interactions you have, take that moment as simple as, "Hey, how are you today?" and then stop and wait for an answer and engage in a dialogue. That will help overcome the vast majority of shortcomings we have in healthcare until we can fix them. And then on the last slide, if you wouldn't mind. And I said this earlier, get it together or we're all going to end up being Blockbuster and Hollywood Video. I would, every time I hear a consultancy or a group say, "Hey, in 2 years, everything's going to be different. In 5 years, everything's going to be different." And here I am 30 years later, and some things are different and a lot really hasn't been. I actually believe the next 2 to 5 years, things are going to be extremely different because COVID has forced it to happen that way and accelerate everything. And I actually think us getting ahead of this and mimicking, for lack of a better term, the experiences customers have with others, while still holding on to the one thing no other industry has, the power to care, is what's going to really drive those that survive and succeed, and those that either die a slow death or disappear kind of immediately, like so many others that we can think of, as digital has consumed brick and mortar to some degree. And with that, I'm going to shut up and see if we have any questions out there that I can answer for people.
Well, thank you, Sean. This was a really thought-provoking presentation. I know we have a number of care provider organizations as attendees for this session, and I think it was really well said as to what they need to expect going forward for their customers, right? So for those that don't know me, I'm John Donnelly, a longtime member of both the NJ and the DVHIMSS chapters, and an ex-board member of NJDVHIMSS, and really welcome the opportunity now to field some questions from the floor here that have come over the course of your presentation, Sean. And I do want to remind those that didn't see the chat initially, get your questions into the Q&A box. We're keeping an eye on them, and we'll try to get to everything that we can. For those that we don't get to for time reasons or whatever, we'll be sure to respond to them, post session here. So, but we do have a couple of very good ones here to start it off. First, you put a couple of general ideas out there, and there was a question here, are there any systems, like here I'm thinking healthcare systems, that are close to providing a good consumer experience? Are there some subspecialties that have done it better than others?
Yeah, so good question. What I've seen, and I've had the opportunity to work with many healthcare systems, independent hospitals that still exist out there in rural communities over the last 5 to 7 years. And I would say two things to answer this question. One is all of them are keenly aware that they need to start doing this better. That's been good to see, because 10, 15 years ago, it was lots of talk about that, but not a lot of action. And I think over the last several years, there's been much more action. And this last year, it's become quite dire to do that. I've had, just speaking from my own personal experience, I've had quite a bit of interaction with Ascension Healthcare. And, like many large health system groups, from a corporate level, they're trying to get on this. From a provider level, at the lowest levels in terms of feet on the street, right? That disparity that always seems to happen between corporate and the folks out in the field. They've done a good job of trying to close that gap, I think. And they've done quite a good job and quite an innovative job working with private industry and private equity, bringing a lot of creative ideas on how do you infuse technology and digital experience in key elements of healthcare, from food and nutrition all the way through just basic care online or in person. They've done a really nice job of trying to combine those things. Doesn't mean it's all perfect. I don't think anyone's perfect out there, but I see the efforts accelerating. And they're one group that I've personally found maybe a little bit further ahead of the pack, trying to not just get there, but integrate that, which is always the big word in healthcare, is integration. And many of us know it's a big word that doesn't always happen as much as people talk about. But I found them to do a nice job in discrete ways of integrating. So there is more of a seamless experience for patients between home care, primary care, the surgery center, digital resources, et cetera. So that's one group that comes to mind.
Okay, thank you. Another question is speaking a little bit of the potential disparity in from a size perspective in terms of able to support this new needs of the healthcare consumer comes from a healthcare consumer, and says, you know, the experience that she has is not the same across the ecosystem of providers that she has. So the larger ones seem to be better and provide portals and give her online application. However, the smaller providers and some of the subspecialties, it's not so consistent, and you know, and they insist on still using paper methods and things like that. So do you see this as a trend in terms of getting to this new environment, you know, with regards to smaller providers? Is this something that's a resource-based problem on their side, or you know, how can we help them with getting on board with your ideas here?
Yeah, you know, that's a great question, and I guess I would have two things to say about that. One is, and again, I'm turning back the clock, and I don't know if the person that asked the question is in an age category where they remember video stores or not. So please forgive me if not. Go talk to your parents or grandparents if not. But if you remember back in the day when videos were just coming out and video stores were just starting, it was mostly mom and pop shops. And then groups like Blockbuster and Hollywood Video came along, and they industrialized the industry and made it much more seamless. And I think eventually those mom and pop shops either went out of business or they got acquired for having footprint and the customer base to grow more quickly as a large conglomerate. That's kind of what I see happening in the area of providers and smaller health groups. They're mom and pop shops. They may provide excellent care, just technologically they're not there. But the big conglomerates are starting to gobble them up now because they need bigger footprints. They need more practitioners. They need more good, caring, quality practitioners. And really what these big conglomerates are providing are infrastructure and scale and technology to allow those practitioners, those mom and pop shops, to do what they do, just kind of do it on a broader scale. So one half of the prediction is what happened to the video industry is going to happen in healthcare. It's just probably how a lot of it's going to go. The flip side is there's such a demand, and even the bigger groups that exist out there, it's not like they're doing it great, right? It's all relative. A small provider or player can take over the world very quickly. Look at Netflix. Again, it was small and it was kind of like the laughing stock way back then of who's going to do that. It's ridiculous. And now who's still in business and who's evolved, right? And so I do think this also is an interesting time. And me having worked in big companies, but typically mostly being an entrepreneur, I believe that any one person or any one group, large or small, can change the world. And I think this is a great opportunity to do that. You see it in the testing and diagnostic area, for example, and not apologize for the shameless plug here. This isn't an infomercial, it's just to make the point. You had one or two or three large players in the testing and diagnostic space. COVID hits, and even they got completely overwhelmed. And the experience that customers would have, the processing, the supply chains, et cetera, after about 6 weeks of COVID, kind of ground to a halt. And so you had all these other little testing companies, like BioIQ, the one I decided to go at, who are mom and pop shops from a size perspective, but technologically giants compared to a lot of the Blockbuster and Hollywood Video groups that are out there in this particular space. And so now what you're seeing out of necessity, because most customers can't get what they need from the larger groups that exist out there, they're turning to the smaller ones. And these smaller groups are growing by leaps and bounds because they've got a better experience. So I would say we've got a bifurcation to answer your question. One is some mom and pop shops are just going to disappear because it's the nature of the evolution of things, and the bigger groups are going to gobble them up and absorb them. And that's probably a good thing overall because it'll advance technologies. However, even those bigger groups have their limits, And we're seeing this in the diagnostic, and we're going to see it in the immunization side as well. The smaller companies, the entrepreneurs, the ones that go, I got an idea and I'm going to get ahead of this, actually have a chance of overtaking even some of the largest groups out there because they've got what the customer needs the way they need it. Now it's just the ability to scale that quickly. So.
Yeah, thank you. Interesting to watch. Well, the next question kind of goes on the other side of the equation, and it is talking about, okay, the health systems with COVID, besides shifting some of their programs to emphasize telehealth, they are also very cost conscious because of the volume of patient flow and things that have declined in this period. So as we look at these new things that we may want to do in the marketplace, you know, they can be costly, and you know, you definitely have an ROI consideration to factor in here. You know, even though these things are valuable, the technologies and the processes, and you know, often the patient consumer or customer satisfaction is not really treated as a hard ROI. It's more of a soft benefit, you know, to the CFO especially, right? You know, so what do we do? How do we get this across, you know, to senior leadership and maybe the states that need to maybe fund some of this, or the payers that need to fund some of this, you know, to see the value and the long-term payoff?
Yeah, you know, this is really hard, isn't it? The reason why I'm 52 but might look 82 is this exact reason, because you're trying constantly, if you want to disrupt the system and move it along, it is like banging your head against the wall sometimes. And this is a human behavior change problem at its finest. It's just more on our side, the healthcare side, than it is the consumer side, as I'd mentioned before. How do you take a group of people, by and large, that may have been working in healthcare and the healthcare system as administrators for 10, 20, 30, 40 years, many times, and say, okay, now you have to flip on a dime. You can't be Blockbuster anymore, right? You have to be Blockbuster and Netflix combined. And then you might actually have to be Netflix. And then you might actually have to do things differently completely. It's really hard to shift a mindset. But here's what's going to happen. It's going to get shifted for them. And I'll use a few examples. So over my career, a lot of the businesses that I've stepped into have usually been turnarounds, not just startups, or not, hey, can you manage this business and, you know, help tweak it a bit. It's been, oh my gosh, we've got a problem. What do we do? And can you come in and fix it? And then also find a new path for us going forward. And in those moments, I've noticed one predominant thing is that many times the administrators aren't listening to the customer, and they only see the staff. And I know this is a horrible thing to say, and I don't mean it as draconian as I say it, but it helps make the point. And they also don't see their physicians and healthcare professionals as their customers either. They see them as a tool or a device to get done what they need to get done as a company. As I've gone out there and I've watched pharmacists and doctors and nurses and allied health professionals and et cetera get more and more administrative, more and more of a cog in a factory machine versus actually providing care, two things have happened. You have a customer that starts getting dissatisfied with what they're getting from these health systems and providers compared to what they're receiving from other industries. And then you also start getting the practitioners themselves getting dissatisfied and unhappy with their work because they're constantly being pressured to do things in a way that gets away from what their hearts and souls are about, which is caring for people versus being an administrative cog or a factory worker, so to speak. And what ends up happening, and what people aren't hearing, and I've been seeing this across hundreds of individual practitioners across many fields that I've personally spoken to over the last 9 months or so, they don't want it to go back to the way it was. They don't like the idea that these cost-conscious health systems, which they do understand, yeah, no margin, no mission. When I worked for the Mercies here in Cincinnati way back when, I had that beaten into my head in a good way. No margin, no mission, no margin, no mission. So they do understand you have to make money to keep things afloat. However, that doesn't mean that's at the expense of the customer or at the expense of the practitioner. And when you really talk to, and I'll use primary care physicians, many of them are saying, I don't know if I want to go back to a physical practice full time. I can actually help people when I work with them virtually. And, you know, it costs more to do that in some regards because we have a real estate cost and then we have a technology cost, which is just another form of real estate, right? It's a virtual office versus a physical office. And so it actually can add expense if you don't do it well. But a lot of the health systems are pushing for, yeah, let's get back to using what we have. Our real estate, what we're paying money for, let's see if we can't get people coming back versus why don't we get people doing things the way that they need to be doing it and want to be doing it? Our customers, the practitioners, and the actual consumer themselves, maybe we don't need all this real estate. Maybe we only need part-time facilities and let's narrow the number. Those are the kinds of things that I see right now happening that actually can change the game, is if the administrators start seeing those practitioners and what they need or want, just as important as what the customer wants. Again, those that don't get that will die a quicker death than those that do. And once that starts to happen, and I know it sounds corny, and I know it sounds like a Successories poster from the 90s, but happy employees do make happy customers. And even online, when the practitioners are in a good mood and they're happy and they feel like they can start to care, it's amazing how net promoter scores go up and how people start using more services preventively even than those that don't. I know that was a long-winded way of getting to a point, but sorry about that.
No, it's okay. I think it made the point very well. You know, one of the things that we've seen a lot of in the trade press is about telehealth, right? So, you know, and the government regulation has definitely eased up on reimbursement for that, et cetera, and you know, put some more impetus with their practitioners, you know, to actually use it. But you know, do you see that there should be more government regulation here to try to help this move and to catch up with this pace of change? And is there something that should be done, you know, internally to show how telehealth does have parity or should have parity with in-person, you know, care encounters? You know, because it does have less overhead. You know, can you speak at all to the telehealth movement?
Yeah, absolutely. So a few things, good and bad, right? What is telehealth? It's video meetings with doctors. Why? And I can remember back when some of the first ones launched, and many of those aren't even around anymore. You know, it was going to completely change how medicine happened in 2 years. And then here we are 15 years later. It's not like they were heavily utilized, right? But then COVID hit, and then all of a sudden they exploded. What is telehealth, telemedicine in its purest form today? It's a virtual office. The difference is instead of one practitioner having one office space online and they can only handle so much people, telemedicine said, hey, we have a network of 1,000 doctors. And so if that one doctor isn't available, we'll pull in another one. So it's not like they got rid of the problem of real-time constraint. They just had more bodies to throw at it. It's like having one physical location with 1,000 doctors that you could see. In COVID, what happened is, and saw this at many employers that I work with, you started getting waiting lines for telemedicine. In other words, they finally started to have enough volume that it exceeded their capacity to serve it. So the same problem you have at a normal doctor office where they're running 20 minutes, 30 minutes, an hour behind, well, it started happening in telehealth and telemedicine. And people were waiting in the waiting room for an hour and a half to see a doctor. So telehealth has helped in one sense, that it's making better use of the practitioners that are available. And so therefore it can see more people. But at a capacity level, they just learned that it's no better than a regular old doctor's office with one doctor in it. Because once you exceed the physical capacity of a doctor to see people and your network, you have the same problem as the traditional brick and mortar situation. So that is something that I think is a good thing and a bad thing. It's a bad thing because what it shows is telehealth and telemedicine as constructed today doesn't actually solve the need to the promise they originally put out there. It has the same problems once you hit capacity. The good thing is that I think what it showed is it's just like a doctor's office. It's just delivering video versus others. So there should be no difference in reimbursement, in the types of things you can do by video if they're possible, because it has the same problem. We just proved that it is a doctor's office with a doctor and it has the same constraints and the same capabilities that a physical office would have. So I think those things have gotten lightened quite a bit from a policy standpoint. I think the states have started to open up out of necessity, and I actually don't see those backsliding dramatically. But I think the good and the bad of telehealth and how it's structured today is actually a good and a bad thing on both sides, right? And in the conversations I've had with regulators at the state and national level, it was almost like an aha that, oh, I'm having to wait for a visit. It's just like a regular doctor's office. Oh my gosh, this is just like a regular doctor's office. Maybe we should treat it the same way. And so actually getting beyond the capacity of telemedicine is a bad thing and an eye opener, but it's actually been a really great thing for regulators to go, oh, I recognize this. And it's the same as the old school style. It's just they can do a little more, but that's really it. So I actually think what's happened is a good thing.
Yeah, I agree. I don't think the care provider model is going to go back to out as it was before percentage-wise with telemedicine. So yeah, I've seen that as well.
Yep.
We have an interesting question. It kind of moves us away from the IT a little bit and speaks a little bit more to the customer demographic.
Yep.
So the question is saying, this person works for a care provider and they have a large percentage of clients who are older, right? And some of them are challenged, to work with the technology and not quite capable of understanding it or having access to it and things like that. Do you see this as a barrier for providers? Do we see somehow an age disparity here in moving to this new ecosystem?
Yes and no. I've been dealing with this for a long time too. Oh, the older generation, they're not going to use the phone. They're only going to want to deal with people in person. And then you find out secretly, oh my gosh, they're all using the phone. And then, oh, the older generation's not going to use the internet or use their cell phones in the same way. So it's going to be a major issue. And then all of a sudden you find out half of them are, and it surprises people. So I would say this is a 50-50 issue right now, based on what I've seen nationally. About half of that notion is wrong because more people in the older age groups are willing and able to adapt because they typically have a younger family member who is the primary or chief caregiver, and they end up doing it for them, or they end up teaching them how to do it. So that's about half of what's going on out there. So I'm very hopeful about that. The other half is that isn't the case, or they do have a younger caregiver, but that younger caregiver maybe isn't helping in some of these ways. So then it is a great issue. The beautiful thing out there, and it just takes time and energy to find, but there are technologies that are really geared, like one button or two buttons to push on a screen to get you to the right place to do the right things instead of a menu of services on an iPad or on your cell phone. So there are a lot of services available out there that can be good for that particular population. The other thing that groups are finding as well is depending on how that individual is classified and receiving maybe home care or could be eligible for certain types of home care, they can actually have a professional caregiver, whether it's a medical professional or just like a comfort keeper type group, go in and do these things for them, and you can get reimbursement for that today, either through a health plan or through special government programs. Takes some time and effort to dig those up in each state because it's not a national thing, it's a state by state thing. But there are resources that are growing and available. But it is still a very significant problem for half or more of the population out there. And I do see that disparity not growing necessarily for those that are disadvantaged with that, but being at least a constant we have to be worried about.
Well, thank you very much, Sean. I think this Q&A was extremely informative. I think thank you for sharing your experiences, and I think the audience welcomes your feedback on your experience with the consumers, the retail marketplace, as well as providers that you've had access to and worked with. So it was really great. But before we close, we have a few last minute announcements. First is please, those as attendees here, you have access to our virtual exhibit hall, which you can get on via the websites, and you can review the products and services from our chapter sponsors. You see a list of them on the slide as it goes by. And you can win some variety of prizes, just like our non-virtual events that we've had in the past. The sponsors have usually come up with some pretty nice prizes for those that come knocking on their door. So if you would check the chat box, you'll find the link to find it for the event on the website. And last but not least, here, let's also, we have the opportunity, I have the pleasure to announce our first session winner for the conference. And remember, that's a $200 gift card. And the winner for this session is Christine Pulano. So Christine, if you would stay on, I think Diane is probably going to interact with you and work out the details of how do you get this card, et cetera. But congratulations to Christine. So with that, again, I hope that you will attend the sessions going forward. We have some really exciting panelists and other keynotes over the next 2 days. And the next one coming up is going to begin at noontime, so you get a little bit of a break. And it's in a bit of a dating game format, which is a pretty interesting way to do panels online, but I think you're going to find it very interesting and enjoyable to see two perspectives on the same problem. So with that, I'm going to sign off, and thank you for attending, and hope to see you on one of the other sessions. So long for now.